It's no secret, addiction is a way of life on Portland streets.
Because I don't like feeling emotions, I don't like feeling the reality.
For people like Brian, there are 2 large-scale treatment and recovery centers in the city. Fora Health in Southeast is one of them. They offer many programs, including walk-in withdrawal management, commonly known as detox.
It's not a process of cleansing. It is a process of 2 things. 1, getting through the dangerous phase of withdrawal, and 2, starting medications.
In the fall of 2022, we were there when people lined up outside Fora Health in the early morning hours, hoping to get a bed.
I tried to go yesterday to another one. Wasn't able to be seen. And then tried again today. Wasn't able to be seen.
Staff routinely turned people like Erica away because the facility was full. That's no longer the case.
We more often have open beds in our withdrawal management unit than we are full. And that has been consistently the case for over a year now.
So why are there empty beds?
So that's the question of the hour. I don't have a neat answer to that wrapped up with a bow.
On this day, 14 of 24 beds were empty.
I mean, it feels awful to have those open beds.
Here's 3 of the empty beds in the women's section.
And our open beds are staffed beds, so we have full clinical staff ready to bring in patients, and we don't have patients showing up for them.
Probably up until the past couple of months is when I really started noticing, we have a lot of beds that are open. I wonder why that is.
Jennifer Burton is a withdrawal management nurse at Fora Health.
I just know that the need is so great, and fentanyl's killing people. So it feels really icky to know that it's such a big, nasty drug out there, and we have the capacity with medications to help people get off of it, and the open beds, and they're not full.
But for the patients she does have,
we have a couple really sick people.
The withdrawal, she says, is becoming more intense.
Yeah, particularly I would say with fentanyl, we've seen it get worse and worse. Our protocols have had to change based on how the fentanyl in this area is changing. It looked different when it was primarily blues versus now it's primarily fentanyl powder.
Those at Fora Health partner with other Portland treatment centers to track patient patterns. Each morning, Fora, along with Hooper Detoxification Stabilization Center in North Portland and Recovery Works Northwest in Deep Southeast, report their number of available beds.
And there are days that nobody is full. That's not every day, but there are days that happens.
This comes as Governor Tina Kotek is backing a bill to spend $90 million to increase the number of treatment beds across the state, including short and long-term care.
Simply increasing that number of beds doesn't then give people a next step after withdrawal management. And those next steps are equally important.
That's part of the reason this man, who didn't want to show his face, camps right across the street from Fora.
Yeah, it's like an endless cycle. Every day you have to figure out how you're going to score.
He's addicted to fentanyl and says he's been through detox at Fora twice.
I know I'll go again. Yeah, because I have a family, I have a wife, I have 2 kids.
Despite the best medication, if you're discharging back to the street or discharging back to a very unstable situation where you're surrounded by use, that is a very, very difficult environment.
We go back to what we know. What we know is the use, the streets. You know what I mean? That's what we do.
So we need housing. We need all levels of supportive housing.
Fora Health has plans to turn this plot of land right across the street into recovery housing for roughly 150 people each year. It's set to open December 2026.
A lot of the neighbors were skeptical about it.
Mary Murphy lives nearby.
Oh, I think it's a wonderful idea. It's a really good usage of this land, and it's close to a hospital, and it's close to TriMet services. And I really like the fact that they're giving families a chance to rebuild.
I don't think the most important story right now in substance use treatment is getting more people into withdrawal management beds. I really think that it is more supportive housing, at all levels of supportive housing. I think that's the bigger story and the more important stories.
So as of noon today, Fora Health had 5 withdrawal management beds available. The detox withdrawal management rooms are communal. When I went in there to take these photos, I was honestly surprised by that. I thought they would feel more clinical or even be isolated and shut off rooms, but the beds are in a line right next to one another, and the staff sits behind a glass window watching and monitoring just in case someone needs anything or there's an emergency. It's not exactly what I thought a detox facility would be like. And staff there told me that's what it's like inside Hooper Detox as well. That's the other large-scale facility in Portland. But back to this seemingly impossible question of why are there empty beds when the need is so great? The Chief Medical Officer, Jennifer Hartley, tells me oftentimes people who want treatment go to an emergency room asking for help. Hartley says there's a lack of staff at the emergency rooms to help people get to a center. And oftentimes people are alone. They would have to travel across town to reach a place like Fora Health. So right there, that barrier could be enough to discourage people from seeking help. And we hear it all the time, but the window of opportunity with addiction is so small. So to help with that, Fora tried a pilot program where on Sundays they opened up admissions from emergency rooms. And they started that in September of 2024. But get this, in all of the Sundays since then, just 4 people were brought in.
I don't believe that there's nobody in the city of Portland on Sunday mornings who needs a bed in a withdrawal management facility. But I think we lack a really cohesive system and also staffing in emergency rooms and other settings, support staff, to facilitate those transitions for people who are often very ill and for whom, getting in a cab and going across the city is really hard.
Now, Hartley also believes there is another piece to all of this that is missing. And it's not something physical like more beds or even more funding.
Kindness and community, to be honest. We're not, in many ways, I think, as a society right now, doing a great job at loving each other and taking care of each other. And I think that is a piece of the narrative that is possibly the most important piece. If we led with that, a lot of the other pieces might fall into place.
So what do you think about the empty detox beds? What is going through your mind right now after seeing that story? Let us know. Email the story at kgw.com or call and leave a voicemail, 503-226-5090.